of you have been diagnosed with IBS, and I want to talk about the problem with that diagnosis. So some people, because they figure out there might be an infection in their gut, then they're labeled as also IBS. How important do you guys think is getting the diagnosis of IBS, Irritable Bowel Syndrome? How important do you guys think that is? Is that a step that's really critical in ending your symptoms relating to IBS or solving the problem? How important is a diagnosis in IBS? Do you guys think it's 100% the most important first step? Is it 50%? Is it 0%, completely useless? What do you guys think? How important do you think that diagnosis is? Well, let me explain from a doctor point of view, behind the scenes, what is a diagnosis, right? IBS, Irritable Bowel Syndrome, the name implies, is a description of symptoms, okay? It's a description of symptoms. It's like saying someone has a headache. So if you say someone has a headache, is that in itself a diagnosis that helps necessarily in any way? Does it solve the problem? Do we know what's causing it? Do we know what the real problem is? That's a problem with some of our diagnoses. The name is just really realizing, putting into a bucket list, a group of symptoms that doctors have no other way of really treating or understanding. We're just having a name to describe the symptoms. It's an irritable bowel syndrome. So as a result of that, it's based on symptoms. So if you look at the Rome 4 criteria, which is the criteria gastroenterologists and doctors use to give you a diagnosis of IBS, is actually really rather simple. Do you have pain? It really is talking about, is there pain associated with bowel symptoms, right? Number 2, is there a change in frequency? And number 3, is there a change in consistency, the quality of bowel movements, right? And I would say by that criteria, the description of those symptoms, every single one of us has at some point in our life could have been diagnosed with IBS. And if that's the case, how helpful is it to have the diagnosis that's just a description of the symptoms? It's like saying to someone, I have diarrhea for 3 months. Okay, so I qualify for IBS because you had pain with, the diarrhea. There is a change in frequency and there's a change in consistency. I have IBS. Okay, right? So I want you to know how simple it is to get that diagnosis and why so many people in the world are actually diagnosed with IBS. If you had to guess how many people in the world actually fit the criteria, the diagnostic criteria I just gave you for having IBS, what percentage do you guys think it is? And based on data out there in the world, it's about 11.8% of people globally currently qualify for a diagnosis of IBS. Okay. Country differences. There's certain different, like North America, South America, there's different countries. Some countries can go as high as 15%. Some countries, the diagnosis rate can be about 6 to 7%. So it kind of goes to show you, like, depending on even the country you live in, or whether you're a man or woman, whether you're diagnosed with IBS or not is also different. Women are way more likely to be diagnosed with IBS than men. Women are also way more commonly go to seek medical attention than men with IBS, okay? And interestingly, women, when you look at all the different types of symptoms associated with IBS, women tend to have more constipation predominant, and while men have more diarrhea predominant, and many people are just a mixture of both. So type in chat, which kind do you think you are, right? And yet, the kind isn't a further, like some people think, oh, I have IBS 2.63, and that's really helpful. Well, it's just telling me that out of all the long lists of IBS symptoms, you have more constipation or you have more diarrhea. My issue with it is when you're looking at, how big of a problem IBS is, right? And how the diagnosis is so easy to qualify for. In fact, 11% of the world right now could qualify for the diagnosis of IBS. The question is how do you solve the problem? What's really causing this problem? Does it move people closer to actually what the real problem is? And one of the problems too with diagnosis is there some sort of blood test that's a secret biomarker that says, you have this blood test and now I know you have IBS, or is there some blood test? Is there some procedure that you can do that says, you do this test and you have the diagnosis? And the answer is no. It's what we call a diagnosis of exclusion. Meaning like, oh, we've ruled out ulcerative colitis or Crohn's. We've ruled out that you have traveler's diarrhea. We've ruled this out. We've ruled that. We don't have anything else we can roll in. we're going to put you in the IBS bucket. Anybody who's worked with me knows that for me, when I work with somebody, I love data. Okay. And when I think about my own mystery illnesses and how I solved them all, it was understanding that there's data, there's facts, there's data, there's medical science and functional natural medicine, putting them together, right? In the case of IBS, right, really importantly is, yes, there's a diagnosis that 11% of the world can qualify for, not helpful, okay? Because if you got the diagnosis and that means you solved the problem, then we're done. Meaning like, if the diagnosis is like, oh, you have an ear infection in your right ear, oh, you're gonna be treated with this antibiotic, and oh, 96% of you won't have that ear infection within the next 10 days. That is a diagnosis that's really important to get quickly, real important to get that treatment, and it's a solvable problem. And that diagnostic step really helps. With IBS, the problem is that diagnostic step doesn't bring people closer to a solution. What we find is when you're looking at IBS and we're looking at data out there is that most people, it is considered a chronic disease, a chronic condition that does not go away, meaning it comes and goes, comes and goes, comes and goes. It isn't a solvable problem out there in the world. Okay. And I want to ask you guys, in your own experience, have you found that IBS was solvable in your case, right? Have you ever, working with the doctors that you've worked with, whether it's conventional doctors, right, or naturopathic doctors, have you been able to solve IBS permanently? Is it a solvable diagnosis in your world or in their world? So the answer from your own experience and from my experience is that getting the diagnosis doesn't, unlike an ear infection, which is a diagnosis that's helpful and treats the problem, getting IBS as a diagnosis doesn't solve the problem. And the data proves it out because IBS is what they call a chronic disease that waxes and wanes over time. Now, the other aspect of this is that, a diagnosis like IBS is to me very similar to a diagnosis of people with POTS, let's say postural orthostatic tachycardia. These types of problems, these diagnoses describe the symptoms, right? And just like POTS, IBS describes Irritable Bowel Syndrome, which is the symptoms, but it doesn't help. And the reason we have that diagnosis is because conventional regular doctors don't know what's causing the problem, right? Because if we know what's causing the problem, we'd be calling it something else, wouldn't we, right? It's really interesting that how many people with the label IBS later will find out through either testing or experience, they start to figure out, oh, wow, there are actually other things that are going on that's causing this problem, of which we think of it like a pyramid. I think of it like a pyramid. Like at the top of the pyramid is, at the top is everybody with IBS, right? But at the bottom of it is all the feeders that are feeding into this list of symptoms that we call IBS. And that's really what's missing from the conversation when we're talking about conventional medical care. Right? So right now, I have one ask, okay? If there's anything that you learned from this today, is there a person, is there one or two people that you think could benefit from even 1% of what I talked about today? If so, click share. Share this video and share it with them.